Hello, good evening. Welcome to week 3. My name is Sarah Oko. This week we're talking about genetics and fetal assessment in pregnancy. And the topic that I'm going to talk about today is nuchal translucency. A nuchal translucency is a test that is done between 10 to 14 weeks of pregnancy to identify a potential risk of congenital anomalies. The test is used to detect an abnormal accumulation of fluid in the posterior cervical area of the fetus, or simply the neck of the baby. For easier understanding, the test measures the thickness of fluid built around the neck. A special ultrasound identifies if the baby is at risk of having congenital abnormalities. If the fluid buildup is thicker, seemingly thicker than normal, it indicates sign of Down syndrome, trisomy 13 or 18. Chorionic villus sampling uses placenta tissue drawn from 10 weeks to 12 weeks, or amniocentesis is done to confirm diagnosis if possible. The test is done with a full bladder and is a non-invasive test. Educate the client on the importance of having a full bladder during the test. 30 minutes before the test is performed, tell the client to inform the provider when the bladder is full and immediately to do the test. It is hard for pregnant women to hold urine, and if they go to use the bathroom, that will cause a delay, and then she has to start all over again, drinking water and all that. According to Kelly et al., increased fetus width and increased accumulation of fluid at the back of the neck, suspected to be aneuploid, and abnormal number of chromosomes gave rise to prenatal screening, especially in the early pregnancy. Increased maternal age during pregnancy is one of the causative factors. History. Continue. In the past, healthcare providers used maternal age to determine if pregnancy is high risk or low risk for trisomy 21. The belief was that the older the woman, the higher the chances of the woman having a baby with Down syndrome. In the early 1980s, the use of advanced technology to investigate low maternal serum alpha fetoprotein was introduced by Meckert and colleagues. Ranges of nuchal translucency. The fluid measure for nuchal translucency is about 2.5 millimeters or less, which is the normal amount of fluid to be seen on the cervical area of the baby. So if the result is greater than 2.5, it is considered abnormal nuchal translucency test result, and also above 3.5, the woman should be referred to a consulting fetal medicine specialist for further testing. Invasive diagnostic tests to rule out nuchal translucency are chorionic villus biopsy. This is simply taking of tissue from the placenta to test for chromosomal abnormalities. Amniocentesis, the use of a long, thin, hollow needle through the abdominal skin to the uterus and into the amniotic sac to withdraw a small amount of amniotic fluid. Codosynthesis. Codosynthesis is a procedure. It's just like amniocentesis, but in this case, instead of going to the amniotic sac, the specimen is withdrawn from the umbilical cord. Indication for the test. For high-risk pregnancy, women with cancer and high blood pressure, age 35 and above, issue with previous pregnancy. The test is for a screening purposes, and also, if possible, diagnose if a client or the pregnant woman has a baby with Down syndrome. Give all pregnant women the opportunity for genetic tests, especially women with a family history of congenital defects. Procedure for the test. The radiologist or an obstetrician trained with special training perform the test. The client needs to maintain a full bladder. Place the woman in a supine position on a padded examination table. Pull the top of the blouse and lower the skirt or pants down. In some cases, the client with the gown is covered with a towel or examination paper. Contraindication. There is no contraindication associated with nuchal translucency tests. Advantage of nuchal translucency tests and disadvantages. The advantage is that early detection of fetal abnormalities allow the parent to choose a treatment option. There are no disadvantages associated with abdominal nuchal translucency. Follow-up tests. The follow-up tests from between 15 weeks to 22 weeks, which include neutral tubes defect, trisomy 18 and 21. The alternative test is a non-invasive prenatal testing known as cell-free DNA testing, a screening test during the prenatal period to test for chromosomal abnormalities. Nuchal translucency is a non-invasive ultrasound diagnostic test to check if the baby is at risk for developing congenital abnormalities. Usually, the nuchal translucency test is performed between 13 of the gestational period. Thank you. I hope I was able to provide the needed information for this class. Thank you and have a good day. Yeah, the references where I got the information from. Thank you.